Inlets of thorax, also known as superior thoracic aperture. So basically, in introduction, the upper narrow end of thorax, which is continuous with the neck, is called as inlet of thorax. It is kidney shaped. Its transverse diameter is 10 to 12.5 centimeter. Its antero-posterior diameter is 5 centimeter. Boundaries of inlets of thorax. So basically, anteriorly, upper border of manubrium of sternum, posteriorly superior surface of first thoracic vertebra, laterally first rib with its cartilage. So these are the boundaries of inlets of thorax. Then there is content of inlet of thorax. So in contact, the structure passing through superior thoracic aperture. Midline, first is from midline, from anterior to posterior, that is first is a sternohyoid and sternothyroid muscles. Then there is a thymic remnant, and then inferior thyroid veins, then trachea, then after that recurrent laryngeal nerve, and after that esophagus, then thoracic duct, then longus colli muscle, then ventral ramus of first thoracic nerve, and after this context to another on the left. So there is on the left, there is a left internal thoracic artery, there is left common carotid artery, there is a left subclavian artery, and there is a brachiocephalic vein, and apices of left lung with pleura, and there is a left vagus nerve, left phrenic nerve. And C, laterally on both sides. So on both sides there is Simpson's fascia. It is a fascia present on lateral sides, and there is internal thoracic artery. On posteriorly from medial to lateral, there is sympathetic trunk, then supreme intercostal vein, then superior intercostal artery, and then the last one is ventral ramus of first thoracic nerve. And then on the right side, so there is cephalic trunk, then right vagus nerve, right brachiocephalic vein, and right phrenic nerve. And after that, there are some clinical aspects of thoracic inlets, which are, if you write in your university exam, you got one extra mark for your clinical aspect. That is so basically the first one is thoracic outlet syndrome, TOS. So this is most common type of syndrome, which is included in thoracic inlet. In thoracic outlet syndrome, nerves and blood pressure vessels compressed, which causing pain, numbness, and arm weakness. And in 90% or in 95% of the cases, there is compression of nerve, and in 5% of the cases, there is compression of blood vessels. And in thoracic outlet syndrome, the symptoms are mainly pain, numbness, arm weakness. These are the main symptoms. And there are vascular issues in which compression lead to Raynaud's phenomena, and Raynaud's phenomena, that is diminished pulses, swelling, and cyanosis of the hand. This is cyanosis of the hand. And there are anatomical variations also, that is abnormal first rib or cervical rib contribute to vascular or neurological thoracic outlet syndrome. So thank you for watching this episode on inlet of thorax. Subscribe.